Oh, let me make sure I've got my. Everyone, it is May. It is Wednesday. We're going to go ahead and get started as everybody is coming in out of the waiting room. I'm going to share just a few slides that we get questions about each time that we have our AgriStress meeting. So I think each time that we do have our meeting, we'll just go ahead and start off with these slides for anybody who's new. So um, we AgriSafe or AgriStress is part of the AgriSafe network, and we have the AgriStress helpline, which goes along with our mental health meeting. And we're happy to say it is now in 11 states. So we're super, super excited about that. It is 24/7, and you can call or text that specific line. And we do have 988 operators who answer our AgriStress helpline. The difference between regular 988 operators and ours is that they've been trained in farm response. So they understand how to speak to a farmer whenever they call in.
Harry, I'm seeing a folder and not the slide itself.
Uh-oh. So, Laura, do you want me to pull that back up or should we start? Okay. All right. We are going to go ahead and get started. Just in case I pop off again. Laura is going to be the host so that if anything happens to me again, everybody else will be good to go. So we're going to go ahead and start off with Seanda. Seanda is going to be our very first speaker, and she's very excited to share with us today. So Seanda, I know you have a PowerPoint. We'll go ahead and let you start sharing. And then when you get connected, you just go ahead and take off with your presentation.
And do I have to request to share? Is that how?
No, you should be able to share. So at mine is at the bottom and it's a green.
Oh, okay. So just, okay.
There you go.
Okay. Sorry.
You're quite all right.
One of those days too. Okay.
And Shonda has a unique topic, things that she's going to share today. It's not going to be our normal.
Sorry. Okay, now we're there. First, I just wanted to say thank you for letting me talk today because I really, while I live in Houston now, I am originally from a small town in rural northeast Texas, Mount Vernon. It's a town of 2,500 people, and my father still lives 6 miles south of that town on 80 acres. So we moved there when I was 5, and I graduated high school from there. And I feel very strongly about rural health care, and because mental health care and rural health care are the same. And so, but talking about collaboration and support and collaboration, I think are a winning combination. So first, we'll just get the hard part out. This is my moment of levity. I have been spending more than 5 decades trying to convince the world that Seanda is actually pronounced Sean, duh, but it's not my fault. It's my parents' fault, and I can't do anything about it other than enjoy. First, we'll just talk about the unique aspects of rural mental health care. One thing that I didn't understand when I was growing up in Mount Vernon is that rural that rural people have a culture, just like every family has a culture. I thought of culture as being something from other countries, people that looked different from me, people that spoke different languages. But what I didn't understand that everybody has culture, and there are things that are very specific to certain groups, and rural and agricultural people have their special things too. I mean, just in general, an interesting thing is that 1 in 5 Americans is living in a rural space. That's about roughly 20% of our population. But the landmass of our rural area in the United States is actually 97%. So 20% of our population lives in 97% of that area. Mental health problems and the risk for suicide are actually higher for people living in rural areas as compared to urban communities. The challenges to access for care are rather unique to rural aspects, or there are some that are kind of specific. And I mean, some of it, there's overlapping, of course, with health insurance, but there's also that issue of access to providers and choice that's a little more specific to rural areas. When I was looking for things to make my presentation more interesting, I was trying to see if there's anything, and I'm trying to get rid of this thing, and I apologize. I don't know how to get rid of this part. So you may not be able to see the very bottom of the slide. Sorry. But anyway, I was looking for interesting factoids. And when I saw that there's an acknowledgement since at least the 1970s that there's a lack of service to the rural population for mental health care, it kind of struck me especially because I was born in 1968. So most of my life there has been a recognition that we're not meeting the mental health care needs of our rural agricultural population well enough. And it's still not there. I mean, obviously that we need it in urban places too, but there are more needs in the rural population than we are addressing. And then interestingly, COVID, in our pandemic, the telehealth system was progressed greatly because of us having to not be together. But strangely, the disparity between urban and rural people actually grew in mental health care, but with telehealth, the telehealth system. And this is just a graphic to kind of represent the suicide disparity for rural versus urban populations. That for the rural area, it's 18.9 deaths per 100,000, whereas in urban populations, it's 13.2 deaths per 100,000. When you break it down by gender, it's 19.93 deaths per 100,000 for males and 4.4 for females. So the death rate for males is significantly higher, and the method is firearms and suffocation is more likely for rural areas. And specifically for young adults and adolescents, it's not only firearms and hanging, but suffocation. Sorry, I got that backwards. For adults, it's more likely to be firearms and hanging. For young adults and adolescents, that it's also suffocation. And as far as access to health care, I live in Texas, and we have 254 counties here in Texas. And since about 2005, there have been the incremental loss of hospitals in various counties in our state. Of the 254 counties, over 70 counties no longer have a hospital. So it makes it harder to get access to health care at 3 a.m. when you only have a clinic. And unfortunately, like in the town that I'm from, Mount Vernon, when I was living there, we had a hospital, but that's no longer the case. It's a small county, Franklin County, but it is the county seat of the county, and it doesn't have a hospital anymore. So that means you have to go further to get to a hospital. And sure, there's 911, there are ambulances, but now they have to go further. And so it just makes it harder for people to get care. And nationally, there are over 135 rural hospitals across the nation have closed. So we really need to do a better job just making sure that everybody has access to health care. One of the other issues with rural healthcare that's kind of more challenging is the various layers of government support. Because when you're dealing with rural areas, you've got the national level of support, the state level of support, and then, of course, the local health departments. Traditionally, that's the federal level oversight has been the U.S. Public Health Service under the Department of Health and Human Services, which includes the Centers for Disease Control and Prevention, the National Institutes of Health, and the Food and Drug Administration. At the state level, you've got state departments of health that coordinate public health, as well as provide some epidemiological services, and epidemiology being the branch of medicine that deals with studying the causes, distribution, and control of diseases in certain populations. And then the fundamental role of public health service, especially in rural areas, often falls to local health departments. And they can serve one or several rural counties simultaneously. And those health departments are overseen by a local board. That organization and oversight of those boards can vary. So because there's not standardization of what that's supposed to look like per county, you can have a wide variety of skills, resources, and priorities to conduct public health functions per county. And so what you get in one county may not be the same thing that's offered in another county. And the rural public health infrastructure is under-resourced. I'll get it out. A local health department may only consist of a part-time employee. And if that person has to get to several towns in a county, that can be a little challenging for making sure that everybody that needs something gets what they need. This slide just basically represents kind of my own personal journey in mental health. The top two pictures, and I apologize for the quality. I know they're not great. That's me and my mom. I'm an only child, and so was she, and she died when I was 16. So I definitely lost a big supporter, and I was in rural America in 1985 when she died, and the resources were pretty slim at that point. The bottom right, that was when I was in college, and the year after that picture was taken, I had a suicide attempt. I went in front of those college roommates, grabbed the kitchen knife, went into the bathroom, locked the door, and they didn't do anything. And I don't use that story to make anyone feel uncomfortable, but I do use it to try to encourage people to think about what you might do if you saw somebody do that. Because when they didn't say anything to me, I felt very alone. And that's kind of part of this on a smaller scale, that's kind of the same thing that a lot of rural people are dealing with, is isolation. And that feeling of being alone is not something that's going to make you want to reach out for help. And it's challenging. On the bottom left hand is my Air Force experience. My first job out of college, I was a nurse in the Air Force. And unfortunately, it was during Desert Storm, Desert Shield, the Persian Gulf War. I'm about 118 pounds. I had an eating disorder. I was bulimic, and I was experiencing depression and my eating disorder. And when I sought help for it, because it was during a wartime, I was no longer worldwide qualified, which I was supposed to go over to Iraq shortly after my internship. So I was ultimately discharged from the military for major depression. So I've literally lost a job for mental illness. So because of all of this, and I'm sharing this because this is kind of what brought me to do what I'm doing, which is by the time I was in my 50s and I hadn't found the job that I really felt fulfilled by, I thought maybe I could use what I've learned personally to help other people like me feel better. And so I did all the work, the legal stuff and everything, and I created Creative Minds, a nonprofit for mental health. And if you're looking at this thinking that's spelt weird, of course, when your name's Seanda, you're kind of used to that. But when I went to the state of Texas to legally get my nonprofit, because I am a 501c3, the correct way of spelling Creative Minds, Creative, and then Minds, was already taken. So in January of 2020, I went with Creative Minds, and I gave myself about 5 years in my head to figure out what could I do to try to help somehow. But of course, because it was January 2020, right before the world shut down, it kind of changed some things I was working on. So ultimately, I got a consultant to help me progress my organization, and he convinced me to get a DBA, a doing business as name. And so now I'm Creative Mental Wellness. And the mission statement essentially is that I'm trying to support people's mental wellness. But I definitely get the question, so what exactly does that mean? And my response is, and you probably can't see all that down there, is that I'm just trying to fill in the gaps of the mental health care system, and uh, and help people elevate their mental health so that they can navigate that system because it's so difficult. And I am doing that through developing programs. And I'll share a little bit more of that in just a second. But as I said, COVID did us no favors, and I had some ideas to use yoga and exercise, but those things would require people being together, and COVID was not a fan of that. Therefore, I had to kind of go back and do some investigation of what could I possibly do that might be helpful to help somebody, be of service, and what that might look like. So basically I started throwing spaghetti at the wall, trying to figure out what could I do. And I had a lot of different variations and iterations of what that could be, and things. It took a while, but I finally, I had given myself 5 years, and this year I finally started making a little bit of traction with this. And so what I've learned is collaboration and partnerships is the way to go. I think I feel very passionately that that is what is going, is us working together. Because what I was learning when I was doing my little investigation is that there's a lot of people out there doing some of the same things, and there's a lot of information out there, but it's not getting to the right people at the right time, in the right moments, in the right places. So I think that if we start collaborating and working together and pooling our resources, we're going to be able to get a lot more done, because it's not about getting to the finish line first. It's about us all getting there healthier together. So what I did is I came up with an idea, and in 2024, we held the first Mental Health Resources Day. And basically, it's a mental health fair where we put on a spotlight on what's available for treatment and support for mental health, behavioral health, and substance use disorder. And it's not, we have vendors, we have speakers, but it's not just about mental health, behavioral health, substance use disorder organizations. It's also organizations that support things that if you don't have food, if you don't have shelter, if you don't have things that you need to meet your needs, negatively impact mental health, then we want to highlight those people too, because it's complicated what can affect mental health status. And so that year we had 7 vendors and 7 speakers. But unfortunately, only 3 weeks before this occurred, I had a head injury and I was in the hospital. And so it was small, but we had to start somewhere because I was kind of busy trying not to die because I had a subarachnoid hemorrhage. And so I was just appreciative that we were able to host it the first time. But the good news is this year we grew, and in January of 2025, we had over 40 vendors and 16 speakers. And if you can notice the difference in the pictures, this is the vibe that I was really going for. This collaboration, this community, and people getting together, not just for the community to find out what's available, but also for these people that work in mental health, behavioral health, substance use disorder, to spend more time, get to know each other, and collaborate more, build bridges, figure out what you can do with one another, do referrals, but whatever we can do to serve our communities more effectively. That's what we need to do. But ultimately, I have a goal to make this national. So I've started planning for our next Houston event on January the 17th, and it's going to be at the United Way here in Houston. But I want to make this national, and I've started trying to figure out how to expand. And so I figured Texas would be the first place to start targeting cities. And I reached out and found a partner in Dallas, Phoenix House, Texas, which they do substance use disorder prevention. And we're working together, and we're going to host Mental Health Resources Day later this year in October. We don't have exactly the date yet, but we're trying to work it out. And I am now targeting Austin and San Antonio. And then I'm also trying to hit all the other cities. So if anybody is from any of these cities, if you know somebody, I am very open to networking and just starting to meet people and figure out what we can do together. Because it's not so much about doing it specifically as Mental Health Resources Day. I'm more interested in just making sure we do something. And just to let you know, another program I've got, I'm a ventriloquist, and this is Daisy, the mental health dachshund. And we have a YouTube channel, and we talk about mental health topics. And this is actually the inspiration behind that, because that's Daisy, my dachshund. And I literally made a puppet of her because she saves my life every day because of that relationship you can have with an animal. So I created Daisy, and she has been traveling with me and meeting people. And I'm just trying to package the information differently so that we can make sure that we're getting to kids as well as adults. And another program I'm working on is Daisy's Book Club. And one thing I wanted to do is to encourage people to read for their mental health. So in June, we're going to start an in-person book club called Daisy's Deep Reads. And then later this year, we'll do a children's version that's called Daisy's Little Sprouts. Another program I'm working on is the Volunteer for You project, and that's to this one's still in the earlier planning stages, and it is to encourage people to volunteer for their mental health. And because I just want to give people some tools to be able to elevate their own mental health so they can navigate the system. Because when you are depressed, I mean, I know this for myself. What's expected of me to get care sometimes, to access care, is asking a lot when you don't have energy, because you don't have motivation because of the issue. So so what I'm reaching out to all of you for is potential collaborations, because we have to start with relationships, and I love meeting people and talking to people and just seeing what we can do together. Because sometimes I don't even on paper what somebody offers to what I'm reading about, I don't understand exactly. And when I meet them and talk to them virtually, I get to find out things that can be really surprised at, and that we can discuss ideas and just kind of let it simmer and just see where it goes. So this is my contact information, our website, and if anybody's interested in talking, I would love to set up a time and chat. And that's it.
Wonderful, Shonda. I was trying to find your YouTube channel. What is it called?
It's here, I'll go back a slide. If you look at Daisy, the mental health dachshund, there's the QR code for it.
Okay,
Just type in Daisy, the mental health dachshund, and that'll
there
get
we go. I found it. I'm going to share that in the chat. I was looking it up by your name and it came up. There we go. I think that's a fantastic idea. You're always looking for unique and creative ways to get mental health out there, that it's in a non-stigmatizing way. So can you tell us, where do you take Daisy? Like, do you actually take her any place in person?
Well, I'm not yet. I'm hoping this summer to start doing in-person puppet shows. And
Okay.
and also with my book club thing, I'm kind of using Daisy as the character of everything. And so when we start the kids book club, I'll get Daisy involved as well. So I've been trying to get into the library system. I've been trying to find friends in schools and stuff, but I just haven't talked to the right people at the right time or whatever. So that's kind of why I just talk to everybody, because you never
Yeah.
know what people know or who they know. And I know that schools have a lot of limitations sometimes with policies and stuff like that. So I, when I'm supposed to get there, I'll get there. But if anybody has any ideas, or if I'm happy to build scripts to address something specific with people. So I'm open to
That's
everything.
fantastic. I think getting into those library programs is a really great start, especially because everybody needs to start in the youth, and we just got to keep reiterating, that same um, point. So Alan in the chat says the big challenge I have, oh, we're getting a lot here. Hold on. Have had is getting people in need into care. I get them to the ER, explain in medical and mental health terms to the triage nurses, but they end up being released within 24 hours and we lose them. Do you have any guidance for Alan?
Well, I mean, one thing I would say is the organizations. I mean, mine is one, but I mean, obviously, I'm kind of small. But a lot of these organizations, NAMI, the National Alliance on Mental Illness, Mental Health America, some of these bigger organizations, if you reach out to them, I mean, I'll do whatever I can as well to maybe get people some resources to help them in their daily lives, because I was a nursing director in a health department in Ohio years ago. And what I learned is, I mean, it's community health that is helping people in their daily lives, and that aftercare, that after treatment, after hospitalization, ER visits, that is the hardest part. And trying to support people, and I mean, it's just a process. And I think normalizing these conversations, talking more openly about some of the challenges, I think is going to be helpful. But unfortunately, I think it's just going to take some time. And that's why I'm just trying to talk to people more and be more open about it, because we've got to be more aggressive about normalizing this.
We do. We do. Shonda, there is a bunch of messages for you here in the chat that are asking like to connect.
Okay.
So when we finish, I'm going to let you go through the chat and you can answer them, but then also exchange contact information if you want.
Okay.
So like you had mentioned NAMI. So Sheila actually said Texas NAMI would help, but there's some other information in there I think that you're really going to enjoy. And this is my favorite part. We were talking about this before the meeting happened, that connecting people to help each other be successful is like my drug. And this right here is why this meeting happens. So I'll let you go through there. But does anybody else have any questions that they want to ask out loud? If you want to unmute, you can go ahead and ask Shonda before we move on to the next speakers. All right. Shonda, we really appreciate you giving us a new perspective and unique aspect on mental health and how to do that. So I believe when we send everything out, we'll go ahead and send, I'll add all of your information in there too in your YouTube channel. We'll start sharing that on our AgriStress social media as well. So thank you so much for joining us today.
Appreciate it. Thank you so much.
Awesome. Okay, so our next speakers, we're actually going to have two. They're going to tag team our meeting. So you guys are probably familiar with Monica. I can't remember if Melissa has been on here before as a speaker, but they are going to go ahead and share with us. They have a really innovative approach to increasing the protective factors among their farmers and ranchers. So we're going to go ahead and let them go ahead and start sharing. And I don't know who's going to go first, but you guys just go ahead and start talking whenever you're ready to present.
Wonderful. Thank you very much for having us. No, I haven't spoke on this particular platform before, but when Monica suggested it, I said, yes, you fill out the thing and I'll be there. So we're so happy to be here. Can you guys see my screen?
Yes.
It's not in
It's not in-
slideshow mode.
Here we go.
There you go.
There you go.
There we go. Okay. So here with suicide prevention in North Dakota, I'm the suicide prevention administrator. My name is Melissa Markegard. Here in North Dakota, I oversee the suicide prevention. Sorry, I'm distracted because I'm moving. I have 3 screens, so I can move some stuff around so I can still see some of you and the slideshow. So here in North Dakota, when I started in my position, I'm very, very I feel very strongly about upstream suicide prevention. You know, I know we talk a lot about risk factors and warning signs and that education piece of what do you do when you see someone who is suicidal or struggling? What are the steps you take when you see them struggling, and how do you help them? So that's great, and we can't go away from those types of trainings, but I also really feel strongly about moving upstream with suicide prevention, so much so that you don't even have the things that we could start implementing don't even have to use the word suicide prevention, but we know that putting some of these things in place does. And so I know I'm kind of talking to maybe I'm not, maybe you guys aren't fully aware of protective factors. But so here in North Dakota, we started taking a little bit of an innovative approach in some of our grant stuff. So last year we put, or 2 years ago, year and a half ago, we put out a request for proposals for community programming. And the main key component of that community programming was building relationships and creating relationships. And so you know, that's all based on creating protective factors. And so really, so we put that out there hoping for something really fantastic. We got a whole bunch of proposals back. We selected 6 of them, and Monica was one of them that we selected. So she will go through that in a little bit, but I just wanted to I'm just on really to say that this is what North Dakota did. It's all under suicide prevention, but it is really building relationships and moving upstream in the suicide prevention approach. So that overall wellness, it's not just being free of disease and illness and stress. We are never going to get rid of all of our stress in our life, because tomorrow something else is going to come up. There's going to be some new bill that we have to pay. There's going to be some new thing that's occurring that is causing us stress in our life. We can't ever get away from that. But what we can do is try and create an emotionally healthy life, so that when those stressors come at us, because we know they're coming, we are able to handle it. And how can we handle it? By creating community resources, by creating community connection, by building that connection so that we feel like we have relationships that we can fall back on. And it isn't just relationships. There's that whole wellness wheel, and I love the wellness wheel, because there is not a piece that some of us couldn't be working on at some point. And if we're working on a piece of the wellness wheel to increase our good mental health, that is suicide prevention as well. But everything is kind of fluid and move. We just have to be ready for that. So I just threw in here suicide prevention program strategies here in North Dakota. One of our very specific program strategies is to increase protective factors that contribute to feelings of social isolation. It's written in our plan. And so that is why we have that. We had that RFP. We actually currently have an RFP live right now for the same thing. And then this is just our help is 3 numbers away. I threw it in because it's important. And I don't know if everybody on the line knows 988, but 988 is always there 24/7 for any kind of crisis. You do not have to be suicidal to call 988. You could be having a mental health crisis, but a mental health crisis doesn't necessarily mean that you're suicidal. So I just wanted to throw it in there. And then this is just my contact information. Again, I work for North Dakota Health and Human Services, the Behavioral Health Division, and I'm the Suicide Prevention Administrator. So with that, I'll just stay sharing my screen, and I will advance to Monica's screen.
Perfect. Thank you, Melissa. So for those of you, you can bump ahead one. For those of you who don't know me, I've been in the ag mental health realm for, since 2016, I think it started. And I do a lot of work in Minnesota, North Dakota, Wisconsin, and really throughout the country, presenting and training on ag stress and mental health, specifically rural mental health is more of an umbrella. But I grew up on a farm in northwestern Minnesota where my family still farms. My son is the 5th generation working with my brother and grandparents. They actually just started in the field today. He Snapchatted me and said, "It's been a bit of a stressful morning." And I was like, as long as everybody's safe and the machines are going, we're good. We'll get there. Seeds are going in the ground. So I've been around farming my whole life, and from a career aspect, really specifically the last 5 to 8 years of my 30-year career. And what I thought was so awesome when I saw the RFP come out through the North Dakota Department of Health and Human Services, a couple things really stood out to me. One, that it was coming from the North Dakota Department of Health and Human Services. So many times I feel like our state health departments aren't in tune to our ag communities. So we'll see initiatives coming through maybe the Department of Ag, or more rural or regional initiatives, but to have something come from the Department of Health and State Department of Health and Human Services to target farmers and ranchers was incredible to me. And to have it as a statewide initiative. And of course, unfortunately, what drives that is that's the demographic in the state that has the highest suicide rates. And of course, North Dakota is a very agricultural state, as many of the states you all are coming from. The second thing that I just really loved is it wasn't about doing more QPRs or more safe talks, which are great trainings. We need those. We need to arm people with the skills to recognize warning signs and to engage with people. But like Melissa said, it took a different approach. It really took that approach of how do we boost protective factors. So as people are going through difficult times, they have some resiliency that is built in. And so I wasn't going to do a proposal because I'm busy. And then a couple of people were like, Monica, have you seen this? You should. I only live an hour from the North Dakota border over here in Minnesota. Spend a lot of time in North Dakota. And I was like, okay, I'm going to do it. But this is the deal. There is not a lot of evidence-based information on how to reach farmers and ranchers. Like it's growing, there's growing research, there's studies out there, but it's new. And so I was like, I'm gonna throw something very creative out there. And if it sticks, great. If it doesn't, it's okay. I'm busy. And so my proposal it was a uh three-tiered proposal. The first, and I'll go through each of these separate. The first was a series of farm and ranch couples retreats. The second was me presenting at egg producer meetings, not meetings focused on stress and mental health, because we know how many farmers would be there, and that would be 0. So the meetings were focused on other things, and then they included me as a piece of it. And then radio spots on local farm networks. So you can flip ahead, Melissa. The first was the farm couple retreats. So I picked 5 locations spread across North Dakota. I made sure they were, in as rural areas as possible, just to help remove the barrier of travel. I had them during the winter when, for most of the producers, that was a slower time. I did accidentally schedule one on deer hunting opener. Big mistake. That one did not fill up, but that wasn't on my mind. So scheduling, when you're working with farmers, you got to have scheduling top of mind. The goals here, in terms of boosting protective factors, was to grow supportive relationships between spouses, because we know how isolated our egg producers are, and many times your spouse is the only person that's going to see you every day. So if there's contention, or there is division in the marriage, that really adds to the risk factor piece. So emotionally supportive relationship between spouses, build that. Increase sense of belonging and decrease social isolation among interactions with other farm couples. Increase ability to problem solve and implement coping strategies. And then, of course, sharing knowledge about 988 and other programs. They were so good, you guys. Oh, it just warmed my heart to sit back. It was a 24-hour retreat overnight, but to sit back and watch the younger couples interacting with the older couples and hear their conversations and how did you deal with this? And people opened up and really became vulnerable about their struggles, suicide attempts, disasters they'd gone through, and they kind of formed over those 24 hours their own little supportive community. And many said, when are we having a reunion? But I know that they stayed in touch afterwards. So definitely a huge goal met. Okay, you can go to the next one. The second tier were producer meetings. So it was to attend 10 producer meetings and as a speaker or presenter. I have 1 to go. I don't know, they've all kind of died out now that everybody's in the field, but I have 1 more to go. Goals were to promote social connectedness among farmers through interaction with their peers, provide resources, and to incorporate learning strategies, talking stress management, coping skills, problem solving, and overall wellness. And it was so fun because those 10 meetings, it was a variety. I had meetings with women in agriculture. I had meetings through extension with victims of the wildfires out west as they were trying to rebuild and going through their grieving process. I was at a transition workshop just talking about transition stress, family stress, coping, conflict, all of that. Met with a group of indigenous producers, so Native Americans that are in agriculture. Ag lenders hosted a meeting. We had rural youth meetings, and communities came together to hold suicide prevention meetings, of which producers were one of the primary attendees. So that was the egg producer piece. The majority were in person. So lots of highway time, but when we're talking rural outreach, that's the reality. Like, I have to replace tires on my car fairly often, and that's okay. And then the third, so one of the barriers to reaching farmers is their lack of attending events. Like it's hard to get farmers off the farm. It's hard to get them to come and sit down and listen to speakers or attend meetings. So when I was looking at unique approaches to really get the word out, it couldn't all be around me being in a location. We needed to think broader. So I partnered with the Red River Farm Network. With Melissa's help, we recorded 8 radio spots, and we got people to, that was the hardest part, is finding people to talk or to have their voices recorded. I thought, not a big deal. Your face isn't going to be on there, but that was a challenge. But I developed just scenarios, real life scenarios that our egg producers go through. And we did a little tagline. I've got a couple examples on the next page, but the goals were reaching that number who aren't going to attend meetings, provide the info about resources, including 988, increase coping and problem solving by sharing useful tips, encourage interventions that limit isolation. So really, we wanted to hit the isolation piece hard. That when you're struggling and you're finding yourself isolating, we really need to be aware of that and start surrounding ourselves with people. So recorded 8, Red River Farm Network, they're giving us a ton of bonus ads, but they run it about 30 times a month, a variety, or about 1 a day. And on the next slide, I just put 2 examples of what the scripts look like. So the first one, 23-year-old 5th-generation farmer, feeling alone and isolated, in this case as a female working in ag, working long hours, feeling disconnected. I realize that those worries don't help me, so I've looked for opportunities in my community to get involved in during the quieter times on the ranch. I volunteer with my church and help with local 4-H and FFA. This has helped me feel less alone and isolated. So simple little messages about strategies that are coming from, real people, real examples. And then the tagline is, you add the value to North Dakota agriculture. Next one, 70-year-old, phasing out of farming, going through that grieving process. And so, I'm now working on accepting and enjoying watching the family legacy continue to the next generation. So really promoting that mindset shift and looking for the positive. And then there were 6 more, variety of ages, from a youth who was not taking over the farm, even though the pressure is there, to a farm wife, to a middle-aged farmer. So yeah, really fun to do. I felt like it was a creative project, thanks to the RFP that the state put out, and that they allowed the creativity to happen. This is my contact info. And of course, at any time, feel free to call, email, text, and I'm happy to chat with you about whatever's on your mind. So
All right.
yes.
Yeah, that was wonderful, ladies. Monica, I was super excited when I saw those 3 initiatives that you have up there. I think that couples was an absolutely amazing way to get couples together because we are on the farm and we don't connect like the quality way that we should as often as we should. The very first question, you kind of hit on this later, that I had was, did you have any trouble filling those spots? Like trying to get them off the farm to come?
Yes. So when I do a farm couple retreat, I do a 10 couple max, because I feel like it's a small enough group that we can really keep we can form a little community. It's not so big that people aren't comfortable sharing. And I think the only retreat that filled was in the very southwest corner of the state. So right by South Dakota, Montana. The others, we had 6, 7, 8, or 9 couples. Some had things come up at the last minute, it cost them nothing. So Melissa and I have talked about that. Would it have been beneficial to have a little like deposit that they got back if they showed up, just so they had some buy-in? Because if there's no, how it is, if there's no skin in the game, it's pretty easy on that morning to look at all the work on the farm and say, we can't get away for 24 hours. So yeah, that would be, learning experience. Would we, if we did it again, would we do something a little bit different? Probably, just to try to ensure that they were filled, because the people who came loved it. I mean, we have really great survey feedback results. Typically, it was the males who were less excited to be there. I know that probably comes as a shock, but once they were there, I mean, I would say 100% said, we're so glad we came. We're so glad we came. They had the opportunity to talk farming with the other people there, and they, were able to talk about their own struggles, improve communication. I mean, it was just a rich, rich experience. So I think it could be grown. But yeah, the attendance, that's the tough part. It cost them nothing. But I think if we would have had a little down deposit that they got back when they showed up, it might have helped people.
Right. Make them take it a little bit more seriously, I guess.
Yeah.
That part was part of my next question, was like when they got there, because it is such an intimate setting, did you feel like they were letting themselves, I guess, be a little bit more vulnerable, even in a group setting?
So the way I have the retreats set up, and they're based on retreats that we've done in Minnesota, I just changed it a little bit, but you really build that sense of safety. So when people are first walking into that room, they're not at a place where they're going to open up and talk. So the first thing I do, we just do really brief introductions. And then the first thing I do is have them work on a marriage timeline. And they and their spouse work on this timeline. They fill in whatever they want, celebrations, traumas, defeats, expansions, losses. And then they go around and then they have like 20 minutes to share about their life and their marriage and their farm. And that's when you can just see the walls break down, and people open up, and there's often tears as they're recollecting difficult times. And so the way they rally around each other and support each other, just amazing, amazing to see.
That's wonderful. Natalie, our CEO, put her information in the chat for you. So AgriSafe has some ability to help in North Dakota. If you guys would want to reach out to her, we would definitely like to be a part of that. There's some other stuff in the chat that I think I'm going to let you guys read over too. Some like suggestions.
Sure.
Is there anybody that wants to unmute and ask Monica or Melissa any questions? I loved all three of those ideas on there.
Hi, my name is Maria Nuno, and my question is there any Hispanic members at all? Is there something that that has been done or has been doing to be able to reach to them? I know probably a language barrier will be very difficult. And also, like in the Hispanic culture, we're really not into mental. So it's something that, that was just my question.
Yeah, and not so much in this program or initiative, but I have done some speaking at primarily dairy programs like dairy initiatives. Wisconsin has Professional Dairy Producers of Wisconsin, and they do an excellent job. There's a large Hispanic audience, and they do a great job having simultaneous translation. So they have a gal who, and I could put you in touch with this person. She is actually a veterinarian. She was a veterinarian in Mexico, and she does the simultaneous translation. They just wear earpieces. So as I'm talking, she's translating, and they're hearing it like as close to real time as possible, which has been a really, I mean, it's impressive that they brought that in and provided that. So the Hispanic, the English as a second language or non-English speaking folks have that option to still attend and get good information.
Okay, thank you so much. It's just something that worries me a lot. I'm second generation, well, first generation, and I know my parents didn't believe in any of the mental health stuff. And I do, and obviously my children, and they're grown. But I can see that the older generation is just like, suck it up, do you like they don't believe in that, which is really
Yep.
important for any aspect of life. So I was just wondering if that's something that's been brought up when with all the situations that's going on right now, that's something that it needs to happen.
Yes, for sure. I agree with you. We need to be sure that we are being culturally competent and reaching out to everyone in a way that meets their needs.
Thank you so much.
Yeah, that's wonderful.
I had a quick question,
ahead.
or just we've kind of focused, like you said, the farmers and ranchers aren't ones to like seek out mental health, and then obviously their medical stuff, they neglect their medical stuff as well. And so we've kind of started reaching out to those around them, the spouses, the farm service agencies, the elevators, the coffee shops, and getting the information to them
Yes.
that way, leaving it there. And I don't know if anybody has any access to 988 stickers. My thought is, and we've done a little bit of this, but having we're getting buy-in from our co-ops and things like that, and because they see the need as well. But like getting that information into their hands. I love the idea of the radio spots. There's a national Agri Talk, and trying to. I'm going to see it's on our local radio station, so to see what we can do to get that going as well.
Yeah.
So
yeah, that's really great. Sometimes we just need a little more added to the call 988. We just need a little more of a boost, I guess.
Yeah, and we've actually kind of the farm, the co-op meetings where they get their checks. We've gotten invitations to come and present at those kinds of things as well, which is, it's a captive audience, so to speak. That is one place they will show up, and if you can get the information to them there as well, is important.
Awesome.
So along those sticker lines, I would reach out to your state health department or health and human services division, whoever holds the 988 SAMHSA grant. Because if an agency would come to me here in North Dakota and request 988 stickers, we would figure out how to get those done and printed if you were going to be using them for a very specific thing. Like I think I saw in the chat, like putting them on receipts or different things, because I think that's a great idea. So I would reach out to see who has the 988 funding for marketing, and see, because stickers are very inexpensive. And so maybe there is an opportunity for that somewhere that the state just hasn't figured out, or whoever has that 988 contract.
How would I find out who has that contract?
Leonard, in the chat, I don't know if this is specifically for stickers, but Haley responded to your comment that said, you order from 988, and she put the actual link in there to order from. So I don't know if it includes stickers. I don't know, Haley, if you want to unmute and if you're still on and let us know that. But she did put, it says orders for 988 in there.
Okay, I see
Can I
that.
mention on the 988 stickers, they have magnets that look like the phones, and those have been very, very popular in our area to stick up on metal places, especially in shops, mechanic shops, farm implement shops, just about everywhere.
And what you guys are talking about is the national 988.
Yes.
And so, and so I
Yes.
think they have a limited amount of what you can order at however many times or whatever. But just so you, like there are opportunities because there is 988 SAMHSA grant funding out there for the majority of the states, and part of that 988 funding is supposed to go to it is in ours anyway, for 988 marketing. And so maybe other states have written in 988 marketing within their grant, and they are maybe looking for places to advertise, put those 988 messages.
Erin, I think you have your, I just noticed Erin's hand up. She's been sitting there so patiently. I don't know if we have time.
Hi, it's just a real quick question. I agree with Maria. I work in a rural county in eastern New Mexico where we have a high Hispanic population. And I'm just wondering, like, what avenues did you go about advertising your couples retreats? Because that's always one of those things. I do have a radio spot every week that I go and talk about what we've got going on with Extension.
Yep.
But I was going to see if there was an avenue for advertising that really drew in those couples, because I'm going to be presenting at New Mexico Cattle Growers coming up in a month. And this is something that I think we could build on, because we're talking about aging in place in rural New Mexico and resources for them. And that would fit in a lot with what we're looking at, is to be able to get those resources to our couples that are in rural areas that do not have the resources, mental health resources especially. So I was going to see what avenues you guys went down.
My greatest marketing resource for the farm couple retreats was boosted Facebook ads.
Okay.
So I just, put in keywords to really target farm families, and the majority found it through there. But then I also sent flyers to like egg lending places, extension offices, anything I could think of that those folks would have access to. But the majority did sign up after seeing a boosted ad on Facebook Marketplace, because you can geolocate where those go out to as well. Or not Facebook Marketplace, just Facebook. Yeah.
You've been selling too much, Monica.
All right. Thank you, guys.
Oh, what a wonderful conversation today. I love it. We will send out all the speakers' information, links to anything that we have today in the email. That is going to follow up with a link to the recording. So if you do have people who missed today, or you're just like, hey, you should really watch this meeting, please go ahead and share that YouTube link, because we want to get it out to as many people as possible, and YouTube is open for everybody. So I know I say this every month, but my gosh, I can't believe next month is going to be June. We're going to be in the middle of summer. So we hope to all see you again, and thank you so much for joining today.